Hello dear students, today we'll discuss about thoracic wall. What do you mean by thoracic cage? The thoracic cage is a skeletal framework that supports the thorax. You can see anteriorly it is formed by the sternum, posteriorly by the 12 thoracic vertebra and the intervening intervertebral disc, whereas laterally you have the ribs and the costal cartilages. So these constitute the thoracic cage. What is thoracic wall proper? The thoracic wall proper includes the thoracic cage plus the muscles, especially the intrinsic muscles, which are also known as the intercostal muscles. What are the coverings of the thoracic wall? So outermost covering is skin, then interiorly you have the superficial fascia, deep fascia which is thin and ill-defined, then you have the muscles. The muscles are of two types. They are the extrinsic muscles and the intrinsic muscles. The intrinsic muscles are also known as the intercostal muscles. So I said initially the thoracic wall proper consists of the thoracic cage and the intercostal muscles or the intrinsic muscles. So what are these extrinsic muscles? The thoracic wall is covered liberally by the extrinsic muscles. So these extrinsic muscles are muscles of the upper limb, muscles of the back and muscles of the abdomen. You can see the muscles of the upper limb. They are the pectoralis major, pectoralis minor, serratus anterior muscle. Then the muscles of the abdomen like the rectus abdominis muscle, external oblique abdominis muscle. Muscles of the back which are the trapezius, latissimus dorsi, rhomboides minor, major, erectus spinae, levator scapulae muscle. So all these muscles constitute the extrinsic muscles that cover the thoracic wall as such. The intrinsic muscles or the intercostal muscles are of three types. They are, in simple terms, you can say they are the external intercostal muscle, internal intercostal muscle and innermost intercostal muscle. And all these muscle layers are lined interiorly by the endothoracic fascia, and which in turn is lined interiorly by the parietal pleura. Before going into the details of intercostal muscles, let's see what are intercostal spaces. You know that there are 12 pairs of ribs, so there are 11 intercostal spaces on each side. So the intercostal spaces are the spaces between the ribs. Now the last two intercostal spaces are open in front because the last two ribs are floating ribs. What are typical intercostal spaces? So typical intercostal spaces are those intercostal spaces that fulfill two criteria. So they are, the first one is, these intercostal spaces are seen between the typical ribs, and the second criterion is that it is traversed by vessels and nerves that are confined to the thoracic wall. So the spaces that fulfill both these criteria are third, fourth, fifth and sixth intercostal spaces. So these four intercostal spaces are known as typical intercostal spaces. Now let's see what's the boundary of the intercostal space or the typical intercostal space. Above you have the lower margin of the upper rib. Below you have the upper margin of the lower rib. In front you have the lateral border of the sternum between the costal notches, and behind you have the body of corresponding thoracic vertebra. Now what is the direction of the intercostal space? You can see here that it is directed downwards and forwards, and towards the vertebral column it is narrower, towards the sternum it is broader, and the broadest region is at the costochondral junction. Now the posterior part of the intercostal space is seen between the two ribs as such. So it is known as the interosseous part, whereas the anterior part of the intercostal space is between the costal cartilages. So this anterior part is known as the intercartilaginous part. So the posterior part of intercostal space is interosseous, whereas the anterior part is intercartilaginous, as it intervenes between the two costal cartilages. Now what are the contents of the intercostal spaces? They are intercostal muscles, intercostal vessels and intercostal nerves. I have already taken 2 classes on the intercostal nerves and vessels. Please go through that. Now we'll discuss about the intercostal muscles. The intercostal muscles or the intrinsic muscles of the thoracic wall are arranged in 3 layers. The superficial layer is the external intercostal muscle or intercostalis externus. The intermediate layer is the internal intercostal muscle or intercostalis internus. The deep layer is known as the transversus thoracic muscle. First, we will see the external intercostal muscle, which is also known as the intercostalis externus, and this is forming the superficial layer of the intrinsic muscles of the thoracic wall. Now, this muscle extends from the tubercle of rib behind to the costochondral junction in front. Now, we have already discussed that the intercostal space has got interosseous part behind and the intercartilaginous part in front. So, the interosseous part of this muscle is fleshy, whereas the intercartilaginous part is membranous. That means the fleshy part extends from the tubercle of the rib to the costochondral junction, where it is replaced by an aponeurosis, and that is known as the anterior intercostal membrane. So the interosseous part is fleshy and the intercartilaginous part is formed by an aponeurosis, that is known as the anterior intercostal membrane. Now, what is the origin and insertion of the extra intercostal muscle? So, you can see here it is extending from the lower border of the rib above to the outer lip of the upper border of rib below. Now, the direction of fibers are downwards, forwards and medially. So, this direction is referred to as the way you put your hands in the pocket. So, that is the downwards, forwards and medially. The intermediate layer is known as the internal intercostal muscle or the intercostalis internus. So this extends from the lateral border of the sternum up to the angle of rib, where it is fleshy, and after the angle of rib it is replaced by the aponeurosis, that is posterior intercostal membrane. Now, what is the original insertion of the internal intercostal muscle? It arises from the floor of the costal groove of the upper rib and inserts into the inner lip of the upper border of the lower rib. So, basically, these muscles are arising from the lower border of upper rib and inserting into the upper border of the lower rib. Now, what is the direction of the fibers? It is just opposite to that of the external intercostal muscle, or it is just 90 degrees to that of the external intercostal muscle. That means the direction is downwards, backwards and laterally. The deep layer is formed by the transversus thoracic muscle. This muscle has got three parts, that is the sternocostalis, the intercostalis intimus and the subcostalis. So the intercostalis intimus is the main muscle, that because that forms the bulk, that is the middle 2/4 of the intercostal space is formed by the intercostalis intimus, and it is also known as the innermost intercostal muscle. Now, what is the original insertion of intercostalis intimus muscle? It arises from the inner surface of the rib above and gets inserted into the inner surface of the rib below. And the direction of this muscle is same as that of the internal intercostal muscle, that is it is directed downwards, backwards and laterally. Now, where is the location of the sternocostalis muscle? So you can see here it is located in the inner aspect of the front of chest wall, and it originates from the lower 1/3 of the posterior surface of the body of sternum, also posterior surface of the xiphoid process of sternum, and posterior surface of costal cartilages of lower 3 or 4 ribs, and it is getting inserted into the lower border and inner surface of the costal cartilage of 2 to 6 ribs, and the direction is upwards and laterally. Subcostalis muscle is a third part of the transverse thoracic muscle, and it's located on the posterior part of the intercostal space. It originates from the inner surface of the rib near the ankle and gets inserted on the inner surface of 2 or 3 ribs below. The direction of the subcostalis is also similar to that of the intercostalis intimus. That means these two are directed in the same way as that of the intercostalis internus or the internal intercostal muscle. That means the direction is downwards, backwards and laterally, but only the sternocostalis is directed upwards and laterally. Now, what are the actions of these intercostal muscles? The external intercostal muscle elevates the rib and thus help in inspiration, whereas the internal intercostal muscle depresses the ribs and helps in expiration. Similarly, the intercostalis intimus part of the transversus thoracic muscle also depresses the ribs, helping in expiration. Now, the subcostalis also acts as depressor of the ribs, whereas the sternocostalis draws down the costal cartilages in which it is inserted. These intercostal muscles also prevent the blowing out or sucking in of the intercostal spaces during respiration. So thus the intercostal muscles act as strong supports for the ribs, preventing their separation. Now, what is the nerve supply of the intercostal muscles? So they are supplied by the intercostal nerves of the corresponding intercostal space. Now, what is the arrangement of the neurovascular bundle in the intercostal space? So, the plane of the neurovascular bundle, that is the plane where you get the intercostal nerves and vessels, are between the intermediate layer and the deep layer. That means it is seen between the internal intercostal and the innermost intercostal muscles. And the arrangement is VAN, that is intercostal vein, intercostal artery and intercostal nerve above downwards. So that is the arrangement of the intercostal vessels and nerve in the intercostal space. I hope this topic is clear for you. Please go through the videos on the intercostal nerves and intercostal vessels to get the complete description regarding the thoracic wall. Thank you.